Good morning, everyone, or wherever you may be. It could be evening. This lecture is going to be on mycotoxin tests and treatments, what works and what doesn't work. And as usual, this is based on medical and scientific evidence and facts. If there's a lot of websites on Dr. Google, or the internet, as I call it, and some others, that give you opinions rather than facts. And what I base everything on is published studies that work, that have basis, and not things that do not have, that are not valid, that don't work, that are just opinion. So let's go forward on this. So this is just a disclaimer. This is not to tell you what to do or how to treat yourself or anything like that. And this is what I do. I'm the editor-in-chief for 4 medical journals, as you can read. I'm a reviewer for several other medical journals, and I'm on the editorial board of some journals. Plus, I also see patients. And this information is provided to you to educate healthcare professionals and everyone else who may be suffering from the effects of molds and mycotoxins, or who have a loved one who does. And I do not profit from any of this. I don't get paid to do this, nor do I promote anything for profit. So, mycotoxins. The World Health Organization calls these the great masquerader of the 21st century. Why? Because it mimics so many other diseases. It mimics chronic fatigue syndrome. It mimics autoimmune diseases. It mimics fibromyalgia. It mimics Lyme. It mimics so many diseases. And then people go chasing after those, and they, month after month, year after year, they're still not better. Why? Because this is the real culprit. So, basic principle, base your diagnostic testing on treatment, on medical and scientific evidence, not on popular so-called experts, websites, blogs, etc. What's interesting to me is these experts put a bunch of letters after their name. Usually these are certificates they've gotten by taking an online course of some type. They're not from medical institutions. They're just put together by some people. They pay for it. They take the course, and now they're certified in this, that, and the other. That doesn't really make you an expert. Anyway, here is basic how to solve problems caused by toxins. The first is detect the cause. Remove the cause, then repair the damage, and the patient gets well. Not after years, 6 months. So mycotoxins, molds produce toxins, and they're called mycotoxins. Molds are always present in homes or workplaces that are water damaged. And when they're there, they're always producing mycotoxins. So mycotoxin exposure is a lot more common than people think. In the United States, 85% of buildings have had past water damage. 43% have current water damage. So these are facts. 2 important points, okay? One is a mold that produces mycotoxins produces a series of mycotoxins. It's not just one mycotoxins. The report said on my house, when it was inspected, said it was aspergillus. Which mycotoxin goes along with that? Many different ones. They found penicillium, many different ones. Okay. And if a mold that's known to produce mycotoxins is present in a home or building, then that then those mycotoxins that those molds produce are there as well. Size matters. Hair is 100 microns thick. Spores are 2 to 4 microns. What does that mean? That these spores, mold spores, will get into the deepest part of the lung, into the alveoli, and from there go into the blood circulation. Now, mycotoxins are 0.1 microns, the same size as a COVID virus. By the way, have you ever heard of a COVID virus being tested for by urine? No. So why do you think mycotoxin can be tested by urine? Anyway, exposure to mycotoxin is by inhalation and dermal absorption, absorbed through the skin. Ingestion is minimal, and we'll see that in a little bit. Chronic inflammatory responses to mycotoxins upregulate aromatase, the enzyme that's responsible in the last step in the biosynthesis, formation of estrogen from androgens or testosterone, converting it into estrogen. Why is this important? And down at the bottom is where this was published. The endocrine disrupting potential of mycotoxins has been investigated to assess interference in estradiol, testosterone, and progesterone production. An increase in progesterone and a decrease in testosterone production were observed. What does this mean? If you have mycotoxins, you're going to have less progesterone. You're going to have more progesterone and less testosterone. Okay? Penicillium toxin. The toxins that penicillium produces, they're a central nervous system, meaning the brain, a depressant. They're a hyperglycemic agent. What does that mean? Increase in blood sugar. And they produce massive bone marrow depression. Meaning there's the inside of the bone marrow is where your blood cells come from and are made. Hepatotoxicity, meaning it's toxic to the liver, and nephrotoxicity, meaning it's toxic to the kidneys. It produces inhibition of testicular spermatogenesis. In other words, the formation of sperm in the testicles, and it inhibition of steroidogenesis, but increases adrenal steroidogenesis and is ultimately sterility of male rats. So we know they do this in rats, but obviously we can't do this experiment in humans. So we have to accept what they do in rats. So here's another one. The effects of deoxynivalenol, another mycotoxin. This one is also known in Europe, especially as vomitoxin. And how does it affect male reproductive function? Serum testosterone concentration were decreased in a dose-related manner. And the weight of the epididymal and seminal vesicles that are part of the testicles in men were significantly reduced. So let's take it for, we talked about progesterone, estrogen, testosterone. Now let's go to thyroid. Patients with a history of mycotoxin exposure experiencing the symptoms of chronic fatigue, cognitive disorders, and different kinds of hypothyroid symptoms, despite the fact that they were taking thyroid hormone replacement, levothyroxine. The most important that's known as Synthroid, by the way. The most important factors in thyroid hormone regulations are the activities of 3 enzymes of the thyroid. These are deiodinase enzymes, and they're DIO1, 2, and 3. In particular, number 2 regulates the activities of thyroid hormone action, okay? So the point being is mycotoxins affect this. Certain mycotoxins are also mycoestrogens. What does that mean? That means they can bind to estrogen receptors, causing confusion in the pituitary gland as to the actual stores of healthy estrogen. While excess estrogen is not a good thing, adequate stores of estrogen are absolutely necessary for proper brain function, gut function, blood sugar regulation, in addition to the obvious hormonal requirements, okay? And the next slide is about causes ochratoxin cause impairment of spermatogenesis, meaning the formation of, this is another one that causes abnormal sperm in men. It's the interesting thing about ochratoxin is 99.8% are very tightly bound, attached to albumin. Albumin is the #1 protein in the body, so it cannot be excreted through the kidneys. It is reabsorbed from any part, both by active and passive transport, etc., from the kidneys. But if you do a urine test, you're always going to find ochratoxin. So explain that if these cannot be excreted. Here's 2 studies that looked at this, and they show it cannot be excreted in urine. How come it's found in urine? You go figure. That's because these tests are not validated. What is the most precise and accurate test for mycotoxin? They're antibodies, blood serum antibodies. Both IgG and IgE measurements of 12 different mycotoxins from MyMycoLab. And MyMycoLab is an international lab. In other words, MyMycoLab tests in all countries. I mean, all over Europe, Asia, Australia, New Zealand, South America, all of North America, including Canada, all of Europe, of course, etc. Eastern and Western Europe. So here's an example of what it looks like to have the test, okay? On the left is IgE, and on the right is IgG. Obviously, there's 12 mycotoxins, and this person is very affected. How to read and understand antibodies. What do they really mean? Well, in the form of microbiology, in the study of microbiology, our immune system reacts to the 4 common pathogens. What's a pathogen? They're the 4 things that cause pathology in humans. In other words, that harm humans: bacteria, viruses, pathogenic fungi, and parasites. So, for instance, when I was a child, I had chickenpox. Today, I have antibodies against chickenpox because chickenpox is a virus, varicella. So that's how the immune system works for these pathogens, these 4 things that microbiology items that cause infection. Now, all these 4 are living organisms. They have cell walls, etc. Okay, and they're transmissible, meaning you can pass them from one person to another, just like a virus, bacteria. It's all these things. These are known. I mean, you know these things. So an IgG antibodies to these means a past exposure. Sometime in the past, you're either infected or exposed or both, okay? But toxins such as mycotoxins, mercury, arsenic, glyphosate, etc., formaldehyde, toxins are not alive. They don't have cell walls. They're just molecules, okay? What is mercury? It's a molecule. On the periodic table, it's known as Hg. Anyway, antibodies to toxins indicate a current immune reaction, not exposure, sometime in the past. And once the toxins are gone from the body, the antibody reaction fades away, it goes away. So what testing should you have? Well, if you have any kind of breathing issues, aside from the MyMycoLab test, you should also do a pulmonary function test. This is a simple test. It takes 10 minutes to do. It's an easy way to find out if your lungs are affected. If there's suspicion of your brain being affected, do a brain SPECT scan. This really gives you a lot of information. What is a SPECT scan? Single photon emission computerized tomography. Well, this is a scan. It looks at the brain in 3D and tells you what parts are over or under functioning. An MRI only gives you structure. This is what it looks like. It's like a loaf of bread, and you take a slice out of that bread and look at it, and you put it back, and you take another slice, look at it, and put it back. For example, if a person has a MRI today and dies tomorrow, and 3-4 days later has another MRI of the brain of the dead body, the two images will be the same. SPECT scan, not so. So that's the important difference and why you should do SPECT. It gives you more information. I always recommend serum immunoglobulins. This is a simple test that's been around, for 50 years, 60 years. This is, what are your immunoglobulins? They're your defense mechanism. There's immunoglobulin A, M, E, and G. However, IgG also has 4 subclasses, subclass 1, 2, 3, and 4. So it's important to have those. I always recommend an autoimmune panel from Immunosciences Laboratory. Why? Because mycotoxins are known to trigger autoimmunity. And although you may not have an autoimmune disease today, you may have one a few years from now. That's why it's important to do this panel. I always recommend the thyroid panel as well. Why? Because we saw how the thyroid is affected. What about mycotoxins in food and then in urine? Well, I'm sorry, but there's a lot of misinformation about this all over the internet. Many of these so-called experts who are not an expert at all. Why would I be an expert? First of all, I've published over 100 studies in medical journals. I have chapters in medical textbooks about molds and mycotoxins. I've lectured at 4 universities. No, I'm sorry, 6 universities, including Harvard in the United States, University of Texas, as well as Oxford University in the United Kingdom. Okay, but these experts are not really experts. They watch things on the internet and then decide to become experts. So low levels of mycotoxins are found in a lot of foods, okay? Cereal, beans. Remember, coffee comes from beans. Fruits, grape juice, beer, coffee, etc. And this is known by the World Health Organization and the United Nations Food and Agricultural Organization. For that reason, mycotoxins can be found in the urine in parts per billion in healthy people. It doesn't mean you're sick, okay? So, a recent study published by Dr. Fry and his group, this is from the summer of 2021, showed that 1 to 4 mycotoxins were found in both pasteurized and unpasteurized milk from cows. 91% of all the milk tested had at least 1 mycotoxin, and 30% had 2 to 4 mycotoxins. However, all the mycotoxin levels were well below what is called TDI, tolerable daily intake, and easily excreted in urine, as are most mycotoxins found in beverages and foods. So no need to worry. It's going to get out of you. It's a part per billion. too small to cause anything, any kind of damage. So, and remember this, what I said about urine and ochratoxin. Okay, it can't come out in urine. So if you have a urine test and you have ochratoxin, you can make an educated decision about that yourself. So here's a study that came out a year ago, and it said the variability of mycotoxins concentration in urine and its volume based on daily intake demands urine sampling at different time points during the day and the normalization of results with creatinine concentration. The inter-individual, meaning inside one individual comparison of mycotoxins, is challenging because of a lot of different factors. Your gender, age, diet, and muscle mass can influence creatinine secretion. And then they further said that the ELISA method, which is the method used by MyMycoLab to detect mycotoxins in human serum, blood serum, comes with significant accuracy, precision, and specificity. Blood doesn't lie. And here's the study. You can look it up. It's available on pubmed.gov, which is the National Library of Medicine. It was published in October 2022. Here's what it says as a screenshot, very recent. And here's what the CDC says. Use of unvalidated urine tests for the clinical diagnosis. Mycotoxins are found in urine of healthy people. So what tests have no medical evidence that they have anything to do with molds and mycotoxins? VIP, the MSH test, all these are really have nothing to do with molds and mycotoxins. They are ask anyone who recommends these to give you something that's been published in a reputable medical journal. They can't. Doesn't exist. These are all sham tests. What is the treatment? First and foremost, first rule of toxicology: get the patient away from the toxin or the toxin away from the patient. Second, simultaneously build back up the immune system while giving the right antifungal medication, not binders and all that stuff. Okay, so here we go. Minimize the environmental exposure. Pesticide exposure, heavy metals from seafood. The larger the fish, the more likelihood they contain mercury. So tuna, swordfish, mercury. Processed foods, artificial sweeteners, artificial food flavorings, colorings, preservatives. Minimize EMF exposures in those patients that are sensitive to it. Common sense. Well, here's a study which said that one has to admit that today the risk of acute intoxications of humans is low, at least in developed countries, and we are a developed country, where the amount of mycotoxins in food items is controlled by the authorities. I mentioned that previously. The amount of mycotoxins tested in foods have been shown in numerous studies to be below this TDI that I told you is tolerable daily intake. It's set by the FDA, the European Food and Safety Authority, which is the EFSA, and the UN Food and Agriculture Organization, the World Health Organization Joint Expert Committee on Food Additives. And let's look at the analysis of mold and mycotoxins in naturally infested indoor building materials. Now, I want to tell you something because here's another false item on the internet. You cannot test for mycotoxins on dust or air or anything else. 0.1 microns, which I showed you before. It's the same size as a COVID virus. Do you think you can test for COVID virus on dust and things like that? No. Anyway, this study is from last year in the summer. Fungi containing foodstuffs are still a global burden, affecting developing countries much more than the developed regions, such as the European Union, where strict regulations are ensuring food safety. So let's take, this is a deoxynivalenol exposure, also known as vomitoxin, as I mentioned before. So look at the last three lines. How much would you have to eat to have toxicity from mycotoxins? So an adult weighing 170 pounds would have to eat 14 pounds of ready-to-eat oatmeal or 20 slices of bread at one time to cause toxicity. If you want, in the top part, a 2-year-old child weighing 28 pounds would have to consume 38 ounces of oatmeal or 3.5 slices of moldy bread. Who's going to do that? No one. No 2-year-old and no adult is going to eat anything that's moldy and eat certainly that much. So there you go. What is the treatment paradigm? Why do I call it a paradigm? Because there's a lot of BS out there, sham treatments that are called protocols. Protocols are one size fits all. So whether you're a 22-year-old female weighing 110 pounds or a 55-year-old male weighing 220 pounds, you get the same treatment. Does that make sense to you? No. It's not how medicine is practiced. And I'm a medical doctor, not any other, I'm just a medical doctor. So the first one is you want to give phosphatidylserine, 500 milligrams, 1 to 2 a day. Why? Because double-blind, placebo-controlled, randomized studies have shown how phosphatidylserine really helps the brain. So one time, one of these, a non-medical doctor, I think it was a naturopath, asked me, well, why not choline? I said, well, show me where it's published that choline helps the brain. Show me. Well, I was in a podcast. I saw it in a podcast. That podcast? Excuse me. Is that medical evidence? No. Anyway, melatonin, 3 milligrams only. You don't need 20, 50 milligrams and all that other BS. 3 milligrams at bedtime. B complex, high levels, therapy. There was a study done in the United Kingdom, in England, at University of Manchester, where they took a group of 200 men who had and tested them with MRI and neuropsychiatric testing to see why they were having memory issues, etc. They gave them B complex to 1/2. They said, follow your doctor's orders, but also take this B complex tablet once a day. The other group, they said, just follow your doctor's orders. A year later, they got these doctors together, and they decided that they were going to repeat the MRI, repeat the neuropsychiatric evaluation, and there was a marked difference between the two groups. The first group that took this B complex, it's called Therapy, and it's available. All these, the 4 are available from Clear Labs. That's where I recommend my patients to get them from. The group that took the therapy improved greatly. The group that did not take the B complex got worse. Vitamin D3, they call it a vitamin, but it's actually a lot more, and it's vital for the immune system. You don't need tons of it. 5,000 international units once a day is what you need. And nitric oxide. and I get it from N101. You take one in the morning, one in the evening. Okay, very direct, very simple. Then I want to talk to you about B complex because it's really important for the body. B vitamins comprise a group of 8 water-soluble vitamins. The collective effects are particularly, so you have to take them all, okay? The collective effects are particularly prevalent to numerous aspects of brain function, including energy, all these from the brain, energy production, DNA, RNA, production and repair, genomic and non-genomic methylation. Notice that, folks. And the synthesis of numerous neurochemicals and signaling molecules. Furthermore, evidence from human research clearly shows that both a significant proportion of the average people, the population of developed countries, suffer from deficiencies or insufficiencies in one or more of this group of vitamins, and that in the absence of an optimal diet, administration of the entire B vitamin group rather than small subsets at dosage greatly in excess of current governmental recommendations would be a rational approach for preserving brain health. There you have it. So nitric oxide, N101, plays key roles in endowing the brain neuronal network, okay, the neurons of the brain, those are the brain cells, with the ability to make continual adjustments to function, because your brain, you may be doing one thing one moment, another moment. So in response to moment changes, okay, and it's also vasodilator, dilates the blood vessels. You get more oxygen and more nutrients to each cell in the brain. You have 100 billion cells and 450 miles of blood vessels. Granted, most of them are capillaries, but every cell in the brain needs oxygen and nutrients. Okay. Vitamin D supplementation. Very helpful for cognitive impairment, vascular dementia, Lewy body dementia, and other conditions that develop due to brain cell malfunction or cell death. And the first place mycotoxins attack is the brain. So low vitamin D levels are associated with increased cognitive impairment, diabetes, cardiovascular diseases, cancer, and respiratory diseases. So please, folks. So basically, the first thing you need is Sporanox, 100 milligrams twice a day. Why? Because mold spores carry the mycotoxins, just like a keychain and a key, okay? So you kill the spore, you kill the source of the mycotoxin. So you're going to need magnesium. I get Mag SRT, and one in the morning, one in the evening. The vitamin D3, as I mentioned, I also get Omega Q Plus Max for my patients. It's formula made by my late friend, Dr. Steve Sinatra, who I knew for decades. He's a good, wonderful cardiologist in Connecticut. So anyway, 2 of those every day. Now, probiotic, it's got to be a spore-forming bacilli. Okay? What is a spore-forming bacilli? I get these from microbiome labs. It's called Megaspore Biotic, 2 every day. So why not use the usual over-the-counter or the one you find in the fridge, etc.? Because Dr. Simon Cutting did studies in England, in London, at Reading University, and found that the majority of Acidophilus and Bifidobacterium that are in all these probiotics die in the stomach. More than 90% are destroyed by stomach acid. He called it dead bacteria therapy. Okay. So get a probiotic that's spore-forming bacilli, because studies show they actually get all the way into the gut and start being a probiotic. Also recommend vitamin C, plain vitamin C, 1 gram 3 times a day. There is no excessive dose or toxic dose of vitamin C. Did you know that? And we cannot store vitamin C, number one, and two, we do not produce vitamin C. So take 1 gram, in other words, 1,000 milligrams 3 times a day. Magnesium. Why take magnesium? Magnesium is the 11th most common element in the human body. This is a master mineral, and it's the necessary ingredient for approximately 350 enzyme systems. And it plays a big role in the majority of the body's metabolic processes. Up to 80% of the population is deficient in this nutrient. So magnesium binding sites have been detected on more than 3,700 human proteins that are essential for building, repairing, and maintaining your body's cells. So magnesium is also a cofactor for a substance known as adenosine triphosphate, ATP, which plays a role in the energy metabolism of cells, the processes by which the body breaks down proteins, carbohydrates, and fats, converting them into energy. So ATP is the energy currency of the cell, the primary product made by your cell's energy factories, which are your mitochondria. Magnesium is required as a cofactor for vitamin C, activating one of the body's most important antioxidant nutrients. Vitamin C is a major antioxidant for support of the immune system. And magnesium is also a cofactor for many other nutrients, including zinc, potassium, vitamin B complex, calcium, and vitamin D. Without magnesium, it would be difficult to absorb and use these necessary substances. Okay. Notice that we don't mention binders anywhere in here because they're sham. What else? What's in omega Q plus max that I mentioned before? It contains the following: fish oils from squid rather than fish, because fish can contain mercury. Contains L-carnitine for your heart, curcumin, anti-inflammatory, coenzyme Q10 for the circulatory system and your heart, resveratrol, which is a wonderful anti-inflammatory from the skin of red grapes. Very important. And so here's what I told you about vitamin C, that we don't make and don't store vitamin C. So we have to get it from an outside source. This is why I recommend to my patients 1,000 milligrams 3 times a day. Almost all fruits and vegetables carry some quantity of vitamin C, but you'd have to eat so much. You'd be eating fruits and vegetables all day long. It's a lot easier to take a capsule. It helps in depression, especially in children, and reduces uric acid levels, reduces the risk for brain cancer, the type that are called gliomas, and it lowers your lipids. I want to show you this picture. It was taken in Dr. Vojdani's lab, Immunosciences Laboratory, where I recommend 2 very important tests. Lyme, it's the only patented Lyme test in the United States. Don't use the other labs. And it's much less expensive. And 2, it's the best test for autoimmune panel. So he did this, Dr. Vajani. 100% pure Florida orange juice. On the right side, that equipment reads the pH. In other words, the alkalinity or acidity. Let me explain it to you for those who are not familiar with pH. 7 is neutral. Anything lower than 7 becomes more and more acidic. anything above 7 becomes more and more alkaline. So as you can see here, orange juice is pretty acidic at 3.3, and apple cider is pretty acidic at 2.3. But let's look at what is very, very popular. Here's two beverages that are at 2.2 and 2.1. How do you think they make it? So when it's a hot day, do you go to your refrigerator and drink a nice cold water of vinegar? No. A cold glass of vinegar? No. You grab from one of these, guess what? How do they make it sweet? They add a lot of sugar or artificial sweetener. Stay away from them. 80% of the immune system is in the gut. So this is the primary place to begin repairing the immune system. The main components is diet, your nutrition, supplements, and probiotics. And as I explained to you before, use spore-forming bacilli for probiotics, megasporebiotic. And for nutrition, try gluten-free for 90 days, avoid dairy, avoid sugar, avoid soy. And the antifungal treatment. Itraconazole is the generic term for Sporanox. Now, all generics are made in India or China. So sometimes they can cause side effects such as stomach upset. If a person has developed stomach upset or some other side effect from itraconazole, I recommend they switch to name brand Sporanox. Infrared sauna, not the other kinds, just infrared is helpful too. And you have to start low and go slow. So don't jump into an infrared sauna, crank it all the way up and stay there for an hour. That is not healthy. So here is this poor gal was treated for SIBO and Lyme and all kinds of things. Finally, she did the MyMycoLab test, which was positive. So this is before starting itraconazole. June 10, 2021, years after 3 months. And she writes this. So there's the evidence. Let's look at something that many healthcare practitioners who don't read the medical literature, don't study what is in medical journals. This is for you. Itraconazole versus fluconazole for the prevention of fungal infections in patients receiving allogeneic stem cell transplant. So what did they say in that study? Prophylactic fluconazole prevents candidiasis. Candida has no activity against molds. However, itraconazole appears to prevent invasive mold infections. Okay, so now we have it. And comparison and of itraconazole and fluconazole for a model of the coccidiodontal meningitis. It's a type of mold. Fluconazole at 10 milligrams per kilo did not reduce the fungal burden in secondary sites, the lungs, kidneys, whereas itraconazole was more effective in clearing the fungi from both organs. Itraconazole was superior to fluconazole in clearing the fungi from the spinal cord and lungs. Overall, itraconazole was more efficacious on a milligram per kilo basis. So here's the difference. Well, yeasts are single cell, okay? There's two types of molds, single cell and multiple cell. Single cell are yeasts. One example of yeasts are candida. Yeasts are used for bread, making bread, for making certain beer and other alcohols, etc. The effective treatment for yeasts is fluconazole. It does not help in multiple cell molds, such as Aspergillus, Stachybotrys, Penicillium, etc. But itraconazole is helpful against all types. So which one would you recommend? You, of course, itraconazole, because it's going to get rid of all of them. So there's a lot of, if you go to Dr. Google, oh, listen, if you take itraconazole, your liver's going to fall out, your teeth are going to fall out, your hair is going to fall out, all kinds of hoopla. Again, it's just hoopla. It's just opinion on the internet. What do medical journals say? Itraconazole, also known as Sporonox, is a common antifungal agent that was developed in the 1980s. It has been in clinical use for 35 years with an established safety record. So 35 years, this was published in 2017, add 6 years to that, so now it's 41 years of established safety record. What works? Here's a study published 3 years ago. These clinical diseases, which are the mold caused by molds, are rather difficult to cure by antimycotics, whereby the azoles such as itraconazole, voriconazole, and liposomal amphotericin B give relatively the best results. So here's one given to critically ill patients. Read the second line. Critically ill patients with acute on chronic liver failure and continuous renal replacement therapy, meaning kidneys and liver are essentially failing. They gave him voriconazole and it was fine. This was 2 years ago, published 2 years ago. If a patient develops new symptoms while undergoing treatment, it usually means new exposure to molds and mycotoxins. The other side of that same coin is that there are people out there who give their patients 20, 30, 40 different supplements. And there's a recent study that took 60 common supplements that were not from reputable companies, that, for example, the ones that I use, but from the internet. Okay, 60 supplements, 11% had what it stated in the label. Okay, so they took these 60 supplements, took them to the lab, examined every supplement, and read the label. 11% were correct. This is what's on the label. This is what's actually in the capsule or tablet. 40% had nothing that was on the label. So be careful. That's another point when people don't get better because they're on way too many supplements and they're called sensitive, very sensitive patients. Yeah, take them off. I mean, I gave you the reasons why. And this is from the medical literature, not from internet opinions and anecdotes. Do not use glutathione in patients who test positive for gliotoxin. This was published a long time ago, in my opinion, 2006. Okay, the activity of glutathione reductase was slightly increased in gliotoxin exposed cells. These results indicate that glutathione promotes gliotoxin induced cytotoxicity, meaning toxicity to cells. Instead of immediately jumping and giving glutathione, read the medical literature, please. Yeah, this is important. After 6 months of treatment, retest. What does not help? HBOT, hyperbaric oxygenation therapy. It lasts very short. There's no evidence that ozone, IV ozone does anything. If I wish somebody would write a study on showing it does. IV treatments with vitamins, yes, it can help, but sometimes it's too much. All right, so what else can we say? Binders, animal studies in pigs, rabbits, sheep, broiler chickens, ducks, turkeys, rats, and mice show that binders help when they're in a laboratory, very specific conditions. There is no medical or scientific published studies to support their use in humans. Okay? So here's what one study published 4 years ago shows. Binders rely on the absorption of mycotoxins from the gut. That's what they're supposed to do, right? And they studied kaolinite clays, activated charcoal, zeolite, bentonite, etc. They are effective in neutralizing aflatoxin, which is rarely found indoors. They are ineffective in all other mycotoxins. In addition, they bind vital vitamins as well as macro and micro elements. Oh yeah, but I take my binder 4 hours before, 6 hours. Read, they are ineffective. They are effective only in aflatoxins. They are ineffective in all other mycotoxins. Okay, don't use binders. And here is evidence of heating, ventilation, air conditioning ducts, refrigerator compressor, and heating, ventilation, air conditioning, air filters. Look at how much aflatoxin was found. Zero. Ochratoxin and trichothecenes. Zero aflatoxin. And I already showed you this one. Here's another test that is a sham test. Organic acid test. Okay, measures liver of organic compound. Measures levels of organic compounds in the urine. And they say, oh, this shows what mold you have. Okay, this is only to check for rare inborn genetic defects, metabolism, mostly in newborn. It is a useless test for molds. If you have some medical or scientific published study that shows it is, please send it to me. What can help a clinician, a healthcare professional? The patient questionnaire is a tool to help guide that person. It includes the first 2 pages, symptoms commonly found in patients suffering from molds and mycotoxins. And this is where the patient scores the symptom from 1 to 10, 10 being the worst. On the left and on the right, they put when did they first notice that symptom? Makes it easy for the clinician. So here it is. Left side, how bad is it? Right side, when did you first notice? You're welcome to have it. So what is the take-home message? If you have a patient that's been diagnosed with chronic fatigue syndrome, fibromyalgia, chronic Lyme disease, autoimmune disorders, you wouldn't believe how many patients I see who've been treated for chronic Lyme disease, Babesia, Bartonella, etc. And for a year, 2 years, 3 years, they're still bad. You do the mycotoxin test. That's what they really have. Also, Marcon's is a completely false test. It has nothing. There's nowhere in medicine that says Marcon's exists even. Okay. So if you've had these and you've seen a number of clinicians, doctors, healthcare professionals without relief, and you continue to be sick, think of molds in the home and or the workplace and mycotoxins, and test for the mycotoxin antibodies at MyMycoLab. I've helped so many patients with that. So if you want a copy of the patient questionnaire, this study, which I published a year ago, along with my colleague, Dr. Leonard Weinstock, who's professor of gastroenterology at Washington University in St. Louis, Missouri. And another study, Lyme disease and mycotoxicrosis, how to tell the difference between the two. And if you want any references, just email me at immunedoctor@gmail.com. And remember, next week, next Wednesday, it's tea time. This is where you can ask me any medical questions, heavy metals, Lyme, Bartonella, Babesia, breast implant illness, molds, mycotoxins, etc. 8 p.m. EST, 5 p.m. PST, and it'll be on next Wednesday. So here's where to write. All righty, folks. That's all for today. Be well, and I'll see you next week.